Hello everyone, this is Dr. Sushma Sarilla, consultant homeopath at Fidicus Homeopathy. Today we are going to discuss a topic called as fibroids or uterine leiomyomas. The reason why we are discussing about these fibroids is that the increased prevalency. If we take on a global scale, people from the age 35 to 39, women from the age 35 to 39 are more prone to suffer from fibroids. But if we take the Indian statistics, according to that, the people or women over the age of 40 are more prone for fibroids rather than people who are under the age of 40. It doesn't mean that people who are younger or older should not suffer, but the statistic says that people over the age of 40 to 45 are more prone to suffer from fibroids. And not only that, the reason why we are discussing about these fibroids is that it disrupts the work-life balance of a woman, and also the complication it is causing during pregnancies makes it a topic of concern. So let's dive into the topic to know in detail what these fibroids are. So what are fibroids? As you can see, fibroids are non-cancerous or benign tumors growing inside the uterus, inside, or you can say near the uterus or inside the part of the uterus. These are non-cancerous growths in the uterus that are made up of muscle and fibrous tissue. See, remember, if I tell you fibroids, it doesn't always have to be big. It can start as a grain of sand, or it can start like a grain of rice, and it can grow as big as a melon. So when I'm mentioning about fibroids, it doesn't always mean it is larger in size. It also can mean it is smaller in size also. So let's get into the signs and symptoms of fibroids. The primary presentation is the menstrual changes. See, in fibroids, we have different kinds of manifestations. Each manifestation depends on the type or the location of the fibroid wherever it is located in the uterus. What are the menstrual changes? For example, if we take subserosal or submucosal, each one has different one. It can present with prolonged bleeding or menorrhagia. It can have intermenstrual bleeding. It can have irregular bleeding. It can have severe dysmenorrhea or painful menstruation. It can have so painful menstruation that the pain extends from the pubis, that is the lower part of the abdomen, back even to your sacral part. And then pressure. See, depending upon the size, the shape, and the location of this fibroid near the uterus, it can cause these pressure symptoms. For example, if it is located near the urinary bladder, it can cause dysuria, that is painful urination. If it is located near the rectal part, it can cause constipation and also painful defecation as well in certain cases. As I already told you, constipation. So what do we do? The next symptom is anemia. Coming to anemia, as I told you, fibroid has different menstrual presentations. Where it has menorrhagia, that is prolonged bleeding, the person will lose a lot of blood leading into iron deficiency anemia. Coming to weakness, because of prolonged bleeding, there will be weakness as well. Reproductive problems, certain section or certain kinds of fibroids can cause infertility. They can cause recurrent abortions also. Obstetrical problems. Remember that certain kind of fibroids can hinder the normal delivery and can prolong the case into a urinary tract infections. If the fibroids are near the urinary bladder, there is every chance that you will be getting urinary tract infections, because the urethral part of the woman is very short when compared to a man. So there is always a risk for the woman, and these fibroids are just super added things. Sudden and severe pain. Whenever there is torsion in the pedunculated fibroid, or whenever there is severe torsion or twisting, then that can lead into severe or sudden pain in the uterus because of the fibroid, and this can progress into a bad stage. Now let's get into the investigation part of fibroids. The primary investigation is pelvic examination. Bimanual pelvic examination of the uterus will reveal if it has any masses or fibroid. Blood test, CBC, complete blood count. If you are having menorrhagia for a prolonged period of time, there can be anemia, that is decrease in your hemoglobin level. And TSH. Remember, people who have higher thyroid stimulating hormone or TSH levels are more prone to fibroids. Hormone profile. Hyperestrogenic state or increased estrogenic state will cause or is one of the major factors for development of fibroids. So whenever you're getting a hormone profile done, we have to check the estrogen level as well as the progesterone level also. Imaging studies. You know, it is like common thing for any person or any woman, if they are suffering from any reproductive problems, the primary investigation, even before consulting to a doctor, they by themselves will do an ultrasound. Yeah, ultrasound will reveal what sort of fibroid it is and where it is located. But if you want to have a deeper look about the construction or histology of the fibroid, we need deeper tests like MRI or CT. Saline infusion sonography. What is saline infusion sonography? There is injection of saline water into the uterine cavity to enlarge the uterine cavity to view the fibroids in a better manner. Then we have hysterosalpingography. So what is this? There is injection of dye into the uterus, and then they will do a sonography of it where it will reveal how the uterus is shaped or how much is the capacity of the uterus. And then there is hysteroscopy where they will be inserting a camera to view the inside of the uterus. And then, as I already mentioned it to you, if you want to have a deeper look into the construction of the fibroid itself, we can do tests like MRI and CT. Now let's get into the structure and function of the uterus or the female reproductive system. Primarily, as you can see in this picture, this is the reproductive system of the female. So here we have the uterus part. These are the fallopian tubes and these are the ovaries. The uterus is again divided into three parts. Primary, the upper part is called as fundus. The lower part is called as cervix, which leads into the vagina, and the middle part is called as the body of the uterus. And not only that, the uterus is made up of three linings. The inner lining is called as the endometrial lining. The middle muscular lining is called as the myometrium, and the outer lining of the uterus is called as the perimetrium. Now let's discuss about the functions of the uterus. See, remember, the uterus is always prepared for the baby. The endometrial thickness or the inner lining of the uterus is increased in anticipation of pregnancy. And if there is no pregnancy, then the endometrial layer, the functional part of the endometrial layer, will be shut down. That is nothing but menstruation. Now let's discuss about the risk factors of fibroids. The first risk factor is race. Caucasian people are less prone to fibroids rather than dark people. Family history. If your mother or your grandmother has suffered from fibroids, there is 50% chance that you will also be getting fibroids. Starting your period before the age of 10. If your first period or your menarche has been occurred before the age of 10, then there is 35% chance that there will be or you will be suffering from fibroid. Obesity. Obesity is one of the main cause in these recent cases of fibroids. Being low on vitamin D. Vitamin D is not only an important vitamin, it is otherwise called as an important hormone also in certain cases because vitamin D regulates a lot of hormones. So having low vitamin D can cause fibroids. Not only fibroids, it can also cause PCOS. Having diet higher in red meat. Remember, having diet which is a lot of red meat and very less amount of vegetables or fiber is called as hyperestrogenic diet, where the estrogen level in your body will increase because of the red meat. Drinking alcohol. Yes, drinking alcohol, even beer, even though it contains very little amount of alcohol, can cause or can be an added risk factor for the fibroid generation if you have a genetic history of fibroid. Causes of fibroids. As we already discussed, gene changes, that is, if there are certain particular set of genes for every work or every function in our body. If there is any alteration in these genes because of radiation or because of environmental changes or because of a genetic history, then that can cause fibroids. Hormones, hyperestrogenic state and even progesterone can add to the fibroid generation. Growth factors. Growth factors like insulin IGF-1. If there is increased or if you are suffering from obesity, there is increased insulin resistance which will lead to fibroid formation. Extracellular matrix. Extracellular matrix is the matrix tightly binds one cell to the other. It is like a sellotape. Okay, increase in this ECM or extracellular matrix is also one of the causes for fibroid growth. Body changes. Now let's dive into the pathophysiological part of development of the fibroid. If we take our body, if you're suffering from obesity or if you're having insulin resistance or if you're eating food which is high in red meat, okay, this will cause lifestyle changes and all will cause increase in estrogen. Okay, what does this estrogen do is that this estrogen will trigger sometimes in hyperestrogenic state. It can form two things. One is PCOS can be formed, which is of different pathology, but it can also trigger the cells in your myometrium. of the uterus. Okay, so what happens is that this cell, which is supposed to be into two, will be producing 6 to 8 cells. There is increased mitosis or increased cell division. Okay, and also not only that, this estrogen will cause increase in ECM, extracellular matrix. These cells which are produced, the fibroid cells, are more prone or will generate more or will proliferate more in even a little bit of estrogen. When you compare a normal endometrium cell to a normal fibroid cell or a fibroid cell, if you are having, for example, say 5% of estrogen, if this endometrium is proliferating at the rate of 1%, this fibroids will proliferate at the rate of 10%. So they are more susceptible or have more receptors for estrogen as well as progesterone. So what is the role of estrogen? It can trigger cell growth and also it can maintain the cell growth. And remember, this progesterone will add to the mitotic part, which will help in further division of the fibroid, which will help in growth of the fibroid. And not only that, increased extracellular matrix will make it larger, thicker and fibrous. There are stages in the fibroid which we'll be discussing later. So remember, obesity in nowadays is the major cause where it can cause hyperestrogenic state, and also consumption of high red meat can cause hyperestrogenic state, which will trigger the stem cells to cause or proliferate a lot, and that will cause ECM to rise, where it will be bound like a small circle or a small tumor, and also the progesterone level will make it grow. It depends on how your hormones are. If your hormones are well balanced, then maybe that fibroid can be in the size of a grain, like for example a wheat grain. But if your hormones are fluctuating really faster, then it can grow larger. It depends upon the hormonal level and the lifestyle that you're leading. Now let's get into the anatomical classification of fibroid. Remember that your presentation of fibroid depends upon the size, shape and where it is located exactly in the uterus. First one is the subserosal or subperitoneal type. Next one is the intramural or interstitial type. The third one is the submucosal type, and the fourth one is cervical leiomyomas. So let's get into the details of it. As you can see in the picture, this is the subserosal type. So what is the subserosal type? As I already told you, the uterine cavity is lined by 3 layers. The innermost layer is called endometrium, the middle layer is called myometrium, and the last layer is called perimetrium. Okay, the subserosal, the fibroid arises in the myometrium or the middle layer, and it is pushed out into the perimetrium. Okay, it is pushed outside. This is called subserosal type. So what happens in the subserosal type is that usually subserosal types are more common, and also they do not present with any particular features. That means you might not be having any irregular periods, or you might not be experiencing prolonged bleeding or menorrhagia. But if this subserosal type is growing really big and it is developing a pedicle, then that is called as pedunculated subserosal type, which can cause a little bit of problem. If it has a longer stalk, it can cause torsion, and also it can cause pressure on the surrounding organs of the body. Next, coming into the intramural type. If you can see, this is the intramural type. What is intramural type? There is fibroid in the middle layer of the myometrium or the myometrium, and it is growing like this. It is putting pressure on both the sides. So what is it is doing? If you can see, it is just altering the shape of the inner cavity of the uterus. So what happens in this intramural type of fibroids is that it will alter the shape, giving into fertility problems. So you will have problem being or getting conceived, and not only that, problem because you will not be able to hold the baby for a longer period of time, which will lead into recurrent abortions. This intramural type can cause abortions, and not only that, it can cause severe menorrhagia. What is menorrhagia? Prolonged bleeding for a longer period of time. That is more than 70 ml of bleeding per your menstruation, per each menstruation, and also prolonged bleeding can cause anemia, fatigue as well as weakness. Next, coming into the submucosal type. This submucosal type, the fibroid will start in the myometrium or the middle layer, and it is protruding inside. inside the uterine cavity. This will also alter the shape of the inside of the cavity, leading into recurrent abortions. Not only that, remember, intramural will cause menorrhagia more particularly, but this submucosal can cause irregular menstruation. So there is difference in the cycles each time you are experiencing. Sometimes the cycle can occur for every 10 days, sometimes for every 15 days, sometimes for every 20 days. So it differentiates. And also the bleeding sometimes can be very scanty, or it can just be spotting. Sometimes it is very prolonged. So these differences in the menstrual cycle are usually caused by submucosal type, which is produced in the myometrium and it is growing inside. Subserosal produced in the myometrium, growing outside. Submural growing in the myometrium and enlarging like this. So we understand the differences. Then coming into the cervical part. Cervical part is usually doesn't give a lot of symptoms if it is not big, but if it is big, it can cause dyspareunia, that is pain during intercourse. And not only that, if it is pedunculated, it can make you feel a little bit of burden down in your abdominal area. You will feel like something is pulling you down. That can be because of pedunculated cervical fibroma or fibroids. Next, coming into the stages of fibroid. Why should we discuss about the stages of fibroids is that the last stage of fibroids can cause severe pain, infection, fever. So what is the first stage of fibroid? As I already told you, it will contain the myometrial part or the muscle as well as the fibrous part. So in the stage 1, you will not be seeing any sort of collagen production. But in stage 2 and 3, you will start experiencing collagen production. If it further goes or the size increases, then that will cause hyalinization of the collagen, or hyalinized collagen will be present. And this hyalinized collagen in the end stage can cause necrosis of the fibroid or sudden collapse, where it will outgrow its own blood supply and it will collapse or become necrosed. And this necrosis can cause infection, which can eventually lead to hysterectomy if not taken proper medication. Now coming into the conventional part. If you're taking the conventional part for fibroids, it can be divided into primary oral contraceptives. Remember that oral contraceptives, like if they are giving estrogen or progesterone, they will have certain side effects. Primarily, they cannot alter or they cannot, cure the problem of the fibroid. First thing. Second thing, the relief is very temporary. As much as using your POP pills or your COC pills, they'll only work only when they are taken inside. As soon as you stop, the problem will again reoccur. And not only that, they have prevalent side effects, like they can cause more intermenstrual bleeding. And not only that, sometimes these oral contraceptives can make the fibrous tissue or the fibroid enlarge in certain cases because of the hyperestrogenic state or the hormonal fluctuation. So is the same with the progesterone. As I already told you, progesterone is very important for mitosis or cell division in the fibrosis. Certain section of people, after taking their POP pills, the fibroid will increase in size. So they have their proper side effects. GnRH antagonist will help you to shrink the fibroid. But what are the side effects of this? They will give you temporary menopause-like condition where you will be experiencing hot flashes, and also you will be experiencing menopausal symptoms for a shorter period of time. And if you stop this, they will again reoccur. Then coming into the NSAIDs or non-steroidal anti-inflammatory drugs. If you are experiencing pain in the fibroid, then they will give you this non-steroidal anti-inflammatory drugs. But remember that if you are taking NSAIDs, your gut bacteria will be destroyed. Primary thing, there will be alteration in your gut bacteria. Even if you are eating healthy, also it will not be absorbed properly. And also in many people, if they are consuming for a longer period of time, will lead into acute gastritis. So along with this, you also have to take proton pump inhibitors. If you stop it, the pain will stop. Remember, it is not curing the pain. It is just not making you feel the pain. So NSAIDs will help you in pain relieving, but they have their own side effects. Next, in conventional treatment part, we have two kinds of surgeries. First one is the myomectomy and next one is the hysterectomy. When they do myomectomy is that they are not touching any part of the uterus, only the problematic area or only where there is fibroid, they will be removing it. But remember, they are just removing the fibroid, but they are not removing the trigger or the cause of it. Myomectomy is a safer part where they will be removing only the fibroid, but your fertility can be increased, or your fertility can be increased with the medications. But in hysterectomy, what happens is that they are removing the whole uterus where your fertility issues will arise. And not only that, myomectomy and hysterectomy will have their own surgical complications if not done properly. And not only that, they are just removing the cause, they are not removing the trigger of it. And by doing hysterectomy, you will be experiencing menopausal symptoms very early in life, which will lead into osteoporosis. Now coming into the homeopathic treatment part of fibroids. So why should we opt for homeopathy? First one, it is non-invasive. There is no instrumentation being put into your abdomen while giving homeopathic treatment. So it is non-invasive. We are not doing any invasive treatments. Second thing, fibroid shrinkage. By the medication that we give, because it does not have any synthetic hormones, it will help in shrinking the fibroid. Hormonal balance, yes, by giving proper medication, by giving medication that is tailor made for you, it will alter the hormonal disruption and making it stable, so the fibroid is also shrinking, your hormones are also proper, and the prognosis is not bad, it is good, it is going into recovery. Then it regulates the menstrual cycle because the hormones are balanced. It prevents recurrences. This is the beautiful part of homeopathy, where in conventional treatment you are just removing whatever is there, but you're not putting a stop to the trigger. You're giving hormonal pills to balance the hormones, but you're not putting a stop to the trigger, which can be obesity, or which can be increase in insulin resistance, which can be increase in ECM, anything, any of the causes or any of the risk factors. You're not addressing that, you're just palliating or managing the case, whereas in homeopathy it will help in preventing the recurrences. And also it is holistic, it is timely, it will help you in preventing fibroids, it help you in curing and also relieving the pain symptoms that you have without any extra medication. Like, you don't have to take a proton pump inhibitor when you're taking homeopathic medications, because it will not alter your gut microbiome and also not cause any sort of problem in your GIT tract. Coming to the precautions part of fibroids, what are the do's and don'ts in fibroids? Primary thing is to maintain a healthy weight. As I already discussed, that obesity is one of the major causes in fibroid prevalence occurring these days. So, managing your weight can be a proper precaution for managing fibroids. Eating a diet which is rich in vegetables and less in red meat. You can eat white meat and also you can eat fish, where there will be increased omega-3 fatty acids, which will help you in relieving the pain. But taking omega-3 fatty acids in a synthetic form can cause hyperestrogenic state. So remember, if you want to take omega-3 fatty acids, obtain it from natural sources like flax seeds. You can obtain it from marine food. But if you obtain it in a synthetic form, it can cause hyperestrogenic state in certain section of people. Next, limiting the red meat and also reducing the alcohol intake. See, alcohol intake, even if you're drinking 1 or 2 beers, which has very little amount of alcohol in it, but if you're having a genetic history, it can trigger fibroids. Exercising regularly will help you in managing weight and the sweat that you produce. Remember, if you're walking just casually, not brisk walk, then that doesn't count as exercise. If you're exercising properly, you should sweat properly. If you're sweating out properly, the hormone level or the stress level will come down and the hormones will be balanced. If you're having intermenstrual bleeding or prolonged bleeding or any menstrual abnormality, it means that your body is trying to tell you something, that there is some problem in your body. Please do get it checked. Let's get into the consultation part at Fidicus Homeopathy. Here at Fidicus, we have two kinds of consultations: online consultation and offline consultation. In online consultation, we have two options, which is audio consultation and video consultation. If you are not staying anywhere near the nearest branch of Fidicus, you can get in touch with the given number. You can consult us through the audio call or through the video call. We will get in touch with you. You can share your investigations with us and we will give you doctor consultation. And not only that, we will be providing you with higher grade top rated medicines which will be delivered directly to your doorstep. If you're staying in India, it will take about 3 to 4 business days. If you're staying in USA, it can take up to 3 to 5 business days. And apart anywhere from this, it can take up to 4 to 8 business days for your medicine to be delivered at your doorstep. If you're staying near the nearest branch, you can come and contact us in person, where we will be giving you doctor consultation. If you're watching this video and you're suffering from fibroids and you want to cure it, you can consult us at Fidicus Homeopathy. You can consult us through WhatsApp, call or ping a message through this number. If you're suffering from fibroids and you want to relieve it and cure it and you have homeopathic physicians near you, why do you want to opt for Fidicus Homeopathy? Here at Fidicus, it is highest chance of health and we follow these three principles. First is the highest success rate that we experience. Second is the transparent treatment. There is no gray area with the patient. It's always black and white where we give you what sort of plan we are following. And not only that, the personal care here at Fidicus is top notch. So if you want to opt for homeopathy, try choosing Fidicus Homeopathy. Thank you.